Up an all new edition of Vow. We talk about why the coronavirus is attacking the black community more than any other. All this and more. All new Vow starts right now. Hello everyone, welcome to this edition of Vow. I'm your host as always, Hendrix here for another edition of Vow. Thank you all for watching Vow this week as we talk about blacks in America are getting hard by the COVID-19 three times more than whites. And with the coronavirus attaching and killing African Americans in an alarming rate, I had to know why. We mentioned that Idris Elba, Kevin Durant, and many more other prominent black figures are getting the coronavirus. They're getting recovering, they're getting treatment, but others, unfortunately, are not at this moment because of it. And that's why we want to know why the coronavirus is attacking the black community more than any other. So this is what we're talking about, the color of COVID-19. So let's see how this all came about with this.
Of course, the toll on workers in this country still showing up at great risk. The grocery store worker who has now died. And at one Michigan hospital alone tonight, 1,500 workers are now showing symptoms. And so Matt Gutman tonight on the workers risking their lives every day.
Tonight, Leilani Jordan's mother says her daughter only stopped working at a supermarket when she could no longer breathe.
She felt that there was a need to be there to support our senior community and people with disabilities.
She was only 27.
When she coded in the hospital, she coded in my arms. When she flatlined in my arms.
African Americans being hit disproportionately hard by the virus. In Chicago, they comprise only 30% of the population, but account for a staggering 72% of deaths.
On the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible.
In Michigan, healthcare workers slammed by a wave of infection. These nurses claim they were sent home after refusing to work without proper safety measures.
We basically were told to leave because we refuse to accept unsafe staffing, unsafe patient load.
25 patients to one nurse.
In a statement, the hospital says it's working on ways to mitigate capacity issues and increase supplies. Another hospital system in the state reporting 1,500 healthcare workers have symptoms. The hospital says they don't know if some of them have the virus because they don't have enough tests. Across the country, private clinics like this California Urgent Care trying to increase those numbers.
Right now, we know that we're under testing. We don't know the extent of the disease, and I think that understanding the disease pattern will help us understand when we can begin to resume normal life.
For Leilani Jordan's mother, life will never get back to normal, but tonight she's pleading for more protection for essential workers.
To protect the people that are vulnerable, to protect the people that take the trash out, protect the garbage men, protect the recycle men, protect those in the dollar store, protect those in even Home Depot, protect the low workers.
It is such an important message tonight, Matt, that when we do go out to the grocery stores and the pharmacies and all these places where these essential workers are still showing up to work, that we have to keep our distance. If we cough or sneeze, do it into your arm or just stay home. We have to protect those workers. And I know grocery stores around the country, Matt, you've been learning, are trying to put in some social distancing rules to protect workers going forward.
They are. Big stores too, David, like Walmart is only allowing 20% of its usual occupancy into stores. Other places like Whole Foods putting up those plastic barriers between customers. But Leilani's mother is saying more needs to be done, and we could do more of it, including wearing masks in stores like that. Just one more thing, David. Leilani's mother called her daughter a butterfly. David.
All right, Matt, thank you.
You saw right there. We talked about it. Like I said, the coronavirus affecting the black community. Even prominent black leaders such as media mogul Oprah Winfrey spoke to ABC's new TJ Holmes about sending a call to action and urging blacks to get tested. Watch this.
Morning to you, Robin. And of course, we know her reach, her celebrity, right? And just the name Oprah. You lend that to anything and it gets attention. But on this particular issue, the health disparities that are devastating the African-American community during this crisis, she says that she has a responsibility to shout out this message as loud as she can. But how does she get the message out in these times? Well, the Queen of Talk has launched a talk show in isolation.
She's already given $10 million to coronavirus relief efforts. Oprah Winfrey now spreading a potentially life-saving message.
What is happening in the Black community is devastating.
From home isolation, the media mogul, in her words, wants to shout as loud as she can about health disparities that have left the African-American community disproportionately impacted in the coronavirus crisis.
Our responsibility is that if you're a Black American, you need to know that if you have that pre-existing conditions that everybody's been talking about, means that if you have diabetes, you have hypertension, you have heart disease, you use an inhaler, you have asthma.
In places like Chicago and the state of Louisiana, African Americans are 70% of COVID deaths, despite making up much lower percentages of the populations. African Americans are more likely to be uninsured and have a host of health conditions that make them more vulnerable to coronavirus. Winfrey will highlight the health disparities in a new special tonight, the latest in her new Apple TV series, Oprah Talks COVID-19.
Were you surprised at how much people seem to be surprised that COVID-19 was affecting our community? Because once you hear the explanation, it's a no-brainer, right?
Gee, TJ, that's an interesting question. Am I surprised that people were surprised? No, I'm not surprised, because people basically, as you know, they think about their own lives, they care about themselves, they're not thinking about other people. So I'm not surprised. But what I do know is that there is a way to connect to the community in such a way, and using language that people stop and pay attention to.
Winfrey says she took coronavirus seriously very early on, in particular because of her own health scare last year.
You know, for myself, I had pneumonia back in August, so I considered that a pre-existing condition because I've been trying to get rid of this bronchial thing since. So I heard it like, whoa, all right, I'm going to be more susceptible.
Winfrey tells me she took measures to protect herself, even from longtime partner Stedman Graham, who she says kept traveling as the crisis worsened.
Even in my own family, Stedman was running around, still speaking in St. Louis, had speaking engagements. I was going, you need to cancel that, Stedman. You need to cancel. And he was like, well, I'm not going to cancel. I'm not going to cancel if they're not going to cancel. I go, you need to cancel. And so it ends up, he didn't cancel. And then when it was time to come home, I go, you can't come in the house. You can't.
This is a sharp dude. You tell me what do you think it is in his head?
Because he just didn't believe, and I think Stedman didn't believe, nor did a lot of other people believe. Well, you can't shut the whole country down. Oh, yeah, you can. Oh, yeah, you can. And yes, we have. So I think because none of us have ever seen anything like this before.
I miss you.
Miss you too. Enjoy your lockdown.
Stedman was in the guest house for a 2-week quarantine before being allowed back into their home.
Our first dinner together in 2 weeks.
Now Winfrey says she's going to turn her focus to lifting the whole country's spirits.
I think this is just the beginning. I think that whatever you're feeling, isolated, anxious, feeling like you want to get on with your life, want to get things back to normal, we're not going to get back to normal. We're going to get back to a new normal. And I think having people be able to accept that, and for a lot of people, that new normal is going to be devastation. And I'm just looking at my life and seeing how I can use what I have, what I know, who I have access to, what I have access to be able to help people on the other side of this.
Oprah is not the only celebrity and the only official who tries to bring awareness to COVID-19, but she has a responsibility, that she says, to get the word out. Former White House official Van Jones talked about COVID-19 crisis and detail how blacks should take this disease very seriously with this.
So I'm here in New York. Where are you? Now you live on the East Coast, but you're on the West Coast now.
I'm in LA.
How is the quarantining for you?
Look, I had to, my ex-wife and still best friend lives in Los Angeles with our 2 boys. So I had to come back out here to be with them. Because listen, this might be the zombie apocalypse. I didn't know what was going to happen. So I've been out here for about 5 weeks. And listen, I've been working. I've been working with Don Lemon on our special we had on CNN, working with Diddy, working with the Reform Alliance, Jay-Z. I'm trying to help our people because this virus act like it hates black people.
And there are a lot of black and brown people who say that this does not affect us. And I'm shocked that you were shocked that I was minding my own business, waiting to watch you and Don the other night on CNN with your special about how it affects black and brown people in this country. And then Van was texting me back like, "You're really watching?" Yeah. I said, "Yes. What do you think I'm doing? I'm not out for crab and a drive around the city. I'm here. I'm here for you. Everybody else watches those concerts and other stuff, and I get it, but I want to watch smart conversation. Talk about it. Please, Van. It was so good."
Well, listen, I can't tell you how much I appreciate CNN for letting me and Don do this special. The special is called The Color of COVID. There may be some more specials because this thing is not hitting black and brown folk the same way it's hitting everybody else. I first started noticing something was wrong when I was in New York, and it was, New York is only 20% black, but 30% of the people dying were black. Then I started looking around. Philadelphia, 40% black. 65% of the people dying are black. DC was 46% of the population, 81% of the deaths. Mississippi, 37% of the population, 63% of the deaths. Georgia, 32% of the population, 55% of the deaths. So this virus acts like it hates black people. And we have to take it a lot more seriously because folks were saying that black people couldn't get it. We're the main ones getting it.
Yeah, we're at a high risk of dying from it. And I mean, whether it's something simple like you have high blood pressure or you have asthma, or that's you with the high blood pressure. Yeah, people do. And also, there is no income that it does not affect.
No. I think that for African Americans in particular, they came on talking about, hey, it's for older people, like your great grandmama in the nursing home might get sick, so you need to wash your hands so you don't get her sick. And then they mumbled it. They said, and if you have some conditions. Well, I said, can I double click on what these conditions are? And it turns out high blood pressure, which is epidemic in the black community, diabetes, epidemic in the black community, asthma, epidemic in the black community, and obesity, epidemic in the black community. I said, wait, hold on. Don't talk to me about great grandmama in a nursing home. You're talking about 30 and 40 and 50-year-old black people who take pills every day for something. If you take a pill every day, or somebody in your family does, if you got an inhaler in your pocket or in your house, you are at grave risk for this virus taking you out. And they didn't say it that way.
Van, what do you think about Georgia opening and these places opening? What do you think, Van?
It's a death sentence for black people. Georgia is a third black. And most of the people who have to go back into these jobs in terms of, the nail salons, whatever, that's all us. And so what I say is, people say, well, Van, how long are we supposed to be in quarantine? When can we get out? I said, let me just talk black to you for a second. If you wanted to go out on a Friday night, and right when you open the door, fools started shooting up the block, bullets going everywhere. You close the door, you quarantine for a minute. When do you go back out? When the fools stop shooting. Rona's still shooting. So don't talk to me about when the quarantine is over. Talk to me about when they have this thing under control with the testing and the tracing so we know where the bullets are going. Otherwise...
Talk to me about the people in prison.
Well, people in prison are in grave danger because, and the Reform Alliance, reformalliance.com, where I work, supported by Jay-Z, supported by Meek Mill, supported by Robert Smith and others, Michael Rubin. The Reform Alliance is one of the organizations working to get people out. In prison, the virus moves 5 to 15 times faster. They cannot self-distance. So we need to get the people out who can't come home, sick folk, old folk, people with minor charges, let them come home to home confinement. Don't put people back in prison for minor charges, and let's get the medicine and the mask into the prisons. And it's not just for the people behind bars. The guards got to come in and out. That can get your whole community sick. And if all the people in prison get sick, then they fill up the hospitals and you can't go. So you can't defeat a plague outside of prison if you don't deal with it inside the prison.
So while we're at home, what can we do to help this cause?
Well, you can go to reformalliance.com and sign up and help our efforts. But also, honestly, spread the word. It's so many people saying, well, it's the Illuminati, it's 5G radio towers. I don't care what the conspiracy is. Right now, it's Black people dying. And so we need to be doing all the things that they say and more to protect our community. The most important thing we can do is be alive to help these fights when this plague is over.
Thank you, Van Jones, everybody. Clap it up for him. Bye, Van. Be well. I'll be watching.
Thank you.
He's so good.
Van Jones appeared on the Wendy Williams show to air his grievances on why it's important to Black people to get tested, because Black people are dying from an alarming rate with the coronavirus, and see if we can prevent that from happening and reduce the number. But unfortunately, a Virginia pastor didn't believe so. He kept having social gatherings until they told his state told him stop having the gatherings for right now. The moment he defied orders and he blasted social distance, and he died himself from complications of the disease. But hear what he was saying about the disease early on, days before his death. Take a look.
I told my children, don't be afraid. Don't be neurotic. Yes, it's out there. But God is out there too.
Bishop has been a friend as well as a spiritual shepherd to so many of us here at New Deliverance and around the country. He will be missed by us all. Saints, don't stop praying. In the next few days, the church will send out information in respect to the final arrangements in this season of social distancing.
Non-essential. We have been discounted and dismissed, but we make a difference. Keep 6 feet. Better keep 6 feet, and don't forget that you could be one day 6 feet under. I can't make y'all think like I'm thinking, but this thing has helped me. It has made me realize my own mortality. And I can honestly tell you of a truth today. If I die, I'm not worried about that. I will not be afraid. I will not be subject. I told my children, don't be afraid. Don't be neurotic. Yes, it's out there. But God is out there too. You ought to never talk about the virus without talking about God. Every time somebody talks about the virus, you ought to say Jesus. I can't hear nobody here. When they talk corona, you ought to say God. 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 God is bigger than the virus. God is bigger than our struggle. He's bigger.
there, that prominent Virginia pastor, didn't make it to see, and he didn't want to follow orders. He knew that he said God was in his hand, but like I said, people need to take heed of that and not trying to ignore guidelines and ignore science and health. So your health and wellness is matter. So a lot of people now need to take that call to action right quick. It was unfortunate for him. So with Van Jones, he spoke the truth and he kept it real with Reggie Williams and everybody else. Just said, wear your face masks. Is that what you need to do? Wear. All right. In the meantime, fashion expert Debbie Smith, who knows nothing too about fashion, she opened up to Tamron Hall about losing her father to COVID-19. This.
Take me, Bevy, to the time when you expected your father to be discharged. I spoke with you. You talked to us on Instagram Live, and you said he's doing okay, and we're expecting him to come home. What changed?
When the nursing homes closed down, which I believe was March 11th, I had gone in to see my dad's social worker, and I said, oh, let's start the discharge for my dad. So at this point, we were getting the Hoyer lift, which is the thing that lifts him into bed. We were getting a new hospital bed. We were getting him a really great wheelchair. You know, we were in the process of everything. When the nursing homes closed down, that's when the pandemic kind of really kicked in. So then we had to make a really tough decision, which I know a lot of families are battling. They're like, do we take our family members out of these rehabilitation centers, out of these nursing homes, and bring them home? And then we have to fear, will we be able to get quality care for them? Because now it's a pandemic, full blown. Also, the concern we had was that my mom is in really great shape and she lives by herself because my dad's not there. So my mom has no visitors. So right now she's incredibly safe. If we have home health attendants coming in and out for my dad, what does that do for my mom? What do we maybe perhaps have a double casualty? Which I know, Tamron, you've been seeing the news reports of families succumbing, you know, yes. Old elderly couples succumbing together. So right. So that was one of the real challenges there.
The service for your father was also a horrible and heartbreaking blow for your family. Yeah. Your mother had to self-distance, socially distance from the family, so you couldn't hug her, you couldn't be there. Even parts of the memorial from the music on, it was nothing like the passing that from our culture that you would expect.
Yeah, and my dad's a World War II veteran as well. So he would have had a full military salute and things like that. We really wanted that. My sister, who was really torn up about that portion of it, you know, she was just like, Daddy served his country and now he's not gonna have the proper memorial. You know, as you mentioned, my mom had to sit, she was probably about 15 feet away from everyone in the family. My mom, as you know, is quite a stylish woman. She couldn't believe when I had to break it to her the day before that not only would she not be able to wear a beautiful outfit to her husband's funeral because he liked to see her look pretty, she was also going to have to wear a bit of a hazmat-esque suit. We put her in a painter's suit with a hood, and she had to wear an N95 mask, and she was sitting there in a corner by herself. It broke my heart.
What is your message regarding what's happening at these nursing homes and rehabilitation facilities, as you've seen firsthand? What do we need to know?
We need to know that we've always been advocating for our loved ones that are in nursing homes, but now more than ever before, we have to be on top of it. We have to call every day, several times a day. We have to ask, are the workers being tested? If someone tests for a high temperature, are they being sent home? We have to ask, are they cleaning the equipment correctly every single day? We have to ask, what kind of personal protective equipment are the workers using? We have to then be checking up on, do they have a COVID isolation ward? Because we know there are cases in every single nursing home. Where are these people being kept? My dad had a roommate up until he went to the hospital on Thursday. My dad died on a Saturday. So clearly he had COVID, but he had a roommate. That's not okay. He should have been isolated. You know, when people come back from hospitals after having COVID, are they isolated, or again, are they sent back to these rooms? If they don't give you answers, you go all the way to the top of the administration. And if they don't give you answers, then you go to your Department of Health and you report these places. Because they're private, they don't have the kind of government interaction that we would like, which is another thing I'm going to be advocating for. These rehab facilities and nursing homes should have patient advocates for every single patient. There should be no way that we had no way of even getting in touch with our dad except for the kind nurses and the certified nurses assistants who took the time. We could not get my dad. We couldn't call the front desk.
Right.
Couldn't call his floor.
Right.
Couldn't get in touch with a social worker towards the end. It's not okay. And again, I'm not blaming them. I'm just concerned about the people.
Baby Smith lost the greatest love of all with her father, but due to COVID-19, it's sad, it's unfortunate, but it happens. You know, when our hearts and prayers go out to Baby Smith at this time. All right. Meanwhile, let's hear what you people had to say about blacks being affected by the COVID-19, especially from black people, on what our community should be doing to prevent and reduce the alarming rate of COVID-19 fatalities with this.
Tonight, we celebrate true heroes, those who are making the ultimate sacrifice to keep us all safe, fed, and healthy. To the doctors, the nurses, and other healthcare workers who are away from their families, taking care of ours, we continue to pray for your safety. To those in the food industry, delivery workers, mail carriers, and sanitation employees who are working so that we can be safe in our homes, we thank you for your selfless service. Black Americans disproportionately belong to these essential parts of the workforce that do not have the luxury of working from home. And African American communities at large have been severely affected in this crisis. Those with pre-existing conditions are at an even higher risk. This virus is killing Black people at an alarmingly high rate here in America. A recent report from my home city, Houston, Texas, it showed that COVID-19 deaths within Houston city limits, 57% of fatal cases are African American. Please protect yourselves. We are one family, and we need you. We need your voices, your abilities, and your strength all over this world. I know it's very hard, but please be patient, stay encouraged, keep the faith, stay positive, and continue to pray for our heroes. Good night, and God bless you.
All right, Chris, we'll see you in a couple of minutes. Now back to the COVID-19 outbreak. The new numbers from the CDC show the toll the virus is taking on Georgia.
The numbers are especially alarming among African Americans. New at 11, Ryan Kruger breaks it all down for us.
For weeks, we've been hearing about the racial disparities among patients with COVID-19. But new numbers just released from the Centers for Disease Control show just how dire the situation is in Georgia. The CDC looked at 8 Georgia hospitals, 7 in the metro and 1 in South Georgia. Researchers found 80% of hospitalized patients with COVID-19 were African American. CDC researchers admitted they were shocked when they saw the numbers for themselves, which was higher than they expected.
And the truth is we've known about these things for a long time in public health and have called on our society to do better.
The numbers also show that the virus can cause significant illness, even death, for previously healthy patients. Of all the patients in Georgia, the CDC found a quarter of them had no pre-existing conditions, and 5% of those patients died.
Now, this is an equal opportunity infection, and just because you're perhaps younger, perhaps healthier, doesn't mean it guarantees you that you're going to, not have any complications of COVID-19.
The researchers did look at some pre-existing conditions among Black people as well, Ryan. So what did they find for that?
Yeah, and one particular disease that really stood out to researchers, Aisha, was diabetes. Nearly 40% of the patients suffering from COVID-19 in Georgia hospitals had diabetes, and unfortunately, African Americans in Georgia are twice as likely to have diabetes in this state.
And finally, the road to recovery for people infected with the coronavirus, many of them have not been identified yet.
But one man from Ohio spoke out from his hospital bed, convinced he would not survive the weekend.
This morning, inside the fight to survive the coronavirus.
Yeah, that's the cough.
This is now life for Kevin Harris. Medical professionals visiting him in the hospital in Ohio are limited and wearing full protective gear.
That's you, and that's me.
The 55-year-old says he started feeling sick about 2 weeks ago after traveling from his home in Warren, Ohio to Cleveland. Doctors then treated him for the flu and sent him home, but his fever and dry cough, a primary symptom of the virus, only got worse. On Friday night, he posted this video to Facebook from his hospital bed, convinced he wouldn't survive the weekend.
Do I want to die suffocating and then going into cardiac arrest?
But this morning, good news from Harris's doctors, who say his lung function is improving.
It's uncharted territory.
This morning, people caring for patients also sharing firsthand accounts. On Instagram, a New York herbalist documenting her struggle to care for her parents, both of whom are infected. She says she's never seen something attack the lungs like this, adding, quote, "I'm powerless against this thing. I can't sleep because I'm so terrified about my dad's breathing, just sitting outside his door."
Having some mild symptoms.
Miami's Mayor Francis Suarez is also sharing his recovery from the virus, hoping to calm some fears.
I feel well. Certainly, I'm sure I'm going to feel symptoms, but I want to document them and let the public know so that they can hopefully have a sense of comfort.
As for Harris, he doesn't know when he'll leave the hospital, and he believes the pandemic will change the world.
It already has, and I think it's going to bring everybody closer.
Kevin Harris says he is sharing his story so that people will listen to the warnings from health professionals.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.
Late this afternoon, we learned 12,262 people in Illinois have tested positive for COVID-19. 33 more people have died since yesterday. We are now at 307 deaths. Within those numbers, a disturbing trend. People in the Black community are 7 times more likely to die from COVID-19 than other races. CBS 2's Chris Ty joins us from the lakefront with sweeping plans announced today. Chris.
Erica, first, why is this hitting the Black community so devastatingly? Well, experts say COVID-19 is particularly punishing against those who have high blood pressure or asthma, diabetes, or lung disease, often exacerbated by those who live inside food or medical deserts, those who live in unsafe neighborhoods with a heightened sense of stress, or tight living quarters.
Out of all of the disparities that are caused by the inequities in our society, healthcare might be the most inhumane. And I think this pandemic of 2020 magnifies that truth.
Of the 98 deaths related to this virus in Chicago, 72% are Black residents of the city. Consider Chicago is only 30% Black as of the last census. And of those Black residents who died, the vast majority had diabetes or heart disease.
Those numbers take your breath away.
In a press conference today with community leaders, Mayor Lightfoot announcing plans to create a racial equity rapid response team and new requirements for healthcare providers to provide deeper data sets on all patients to try and track vulnerable patients more thoroughly.
No one should have where they live determine how long they live.
COVID-19 exposing a decade, even centuries-like disparity between racial lines.
I think it's that big picture of what causes disparities, that it's not individual health behaviors or choices, that it's really these structural factors in society that go back to racist policies and discrimination.
Looking at Illinois as a whole, it's a state that's 14% Black, but Blacks make up 30% of all COVID-19 cases in Illinois and make up 41% of the state's COVID-19 deaths.
Today is a call to action. It is a call to signal that we are not going to tolerate these kind of disparities.
The mayor's Racial Equality Task Force will have a voice and a seat at the key table in the city. They will be there at the Emergency Operations Center as new crisis points come in, helping devise new strategy and plans as this troubling trend line continues to be monitored. Live on the South Side, Chris Ty, CBS 2 News.
There's this myth that Black people or people of African descent cannot get coronavirus. I have no idea where this notion originated from. There is nothing inherent about us as Black people, Afro-Caribbean people, people of African descent, melanated people, like whatever, however we identify ourselves. There's nothing inherent about us that prevents us from getting this infection. And I know of multiple friends, acquaintances, and colleagues who are Black people who have family members who have succumbed to this infection or are critically ill as a result of it. So we are not immune. The increased number of comorbid conditions that we experience, like high blood pressure, diabetes, being obese and overweight, these are all, starting to become more clearly delineated risk factors as more and more people get impacted by this infection and as we learn more. And then we have all of the other same issues that everybody else in the world has. So cancer diagnoses, autoimmune diseases, asthma. Asthma is actually increased in prevalence in city communities and more densely populated communities. Our children and our adults tend to have more frequent diagnoses of asthma and tend to do worse with these types of conditions. And then other things that we might do habitually. So are you a smoker? Are you a drinker? And then our communities tend to not have immediate access to healthcare. And then on top of that, sometimes we're dealing with healthcare disparities. So are we being taken seriously when we present for medical attention? CDC is always putting out information. The World Health Organization is putting out daily updates. You can tune into these very readily on their social media platform. They have done a great job of communicating the information that we need to know in lay terms that people can understand. And they're giving a global report. And then you can tune into your city and state, either local health departments or governing bodies who are giving updates online as well. We have to tackle this thing from every point that we can possibly tackle it so that we diminish the spread in our community so that we can flatten the curve. It's not going to go away quickly, but we all must do our part and really take this thing seriously if we're going to get ahead of it.
At the president's direction, yesterday I met with 2,000 Hispanic leaders from their communities. And today, the vice president led a phone call that I was on with hundreds of African-American leaders, including the Reverend Jesse Jackson, including Derek Johnson of the NAACP, including the National Medical Association and the Black Nurses Association, to talk about some of the alarming trends we're observing regarding the impact of COVID-19 on communities of color. And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, Blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans, develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and Black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. And I hope that showing you this inhaler shows little kids with asthma all across the country that they can grow up to be Surgeon General one day. But I more immediately share it so that everyone knows it doesn't matter if you look fit, if you look young, you are still at risk for getting and spreading and dying from coronavirus. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact, likely that the burden of social ills is also contributing. Social distancing and teleworking, we know, are critical, and you've heard Dr. Birx and Dr. Fauci talk about how they prevent the spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanics has a job that lets them work from home. People of color are more likely to live in densely packed areas and in multi-generational housing situations, which create higher risk for spread of a highly contagious disease like COVID-19. We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water. So how are they going to do that? In summary, people of color experience both more likely exposure to COVID-19 and increased complications from it. But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19. There is nothing inherently wrong with you, but they are socially predisposed to coronavirus exposure and to have a higher incidence of the very diseases that put you at risk for severe complications of coronavirus. But as the Vice President shared on the call this morning, this history, and I want you to hear me say this, it does not have to be our nation's future. We're taking steps now in the midst of the COVID-19 pandemic to reach, protect, and strengthen all communities impacted by this disease, and especially our communities of color. More detail.
COVID-19 has really devastated every community in this country. And for some states, they are reporting it is really impacting the African-American community the most, with Black patients dying at a much higher rate than any other groups. WMAR 2 News' Ray Strickland joins us live tonight from Sinai Hospital. Ray, you had a chance to talk to a doctor tonight who was researching this issue even before the outbreak.
Yes, and she found because of social disparities such as lack of resources and access to health care in the African-American community puts them more at risk of having a severe case of the coronavirus. That's why city and state leaders are urging the health department to include race and zip codes in their coronavirus data in hopes to better protect a community that seems to be the most vulnerable.
We've seen some of the numbers from around the country, and it's pretty frightening.
As cases of the coronavirus continue to grow nationwide, some states are finding one community in particular is being hit the hardest.
About a third of the hospitalizations are for African Americans, even though they make up about 20% of the national population.
Dr. Susan Mani is the Chief Population Health Officer at LifeBridge Health in Baltimore. For the past 2 years, she's collected data on social disparities in the African American community to help improve health outcomes. Dr. Mani says inequalities such as lack of resources and access to health care makes African Americans more likely to have pre-existing conditions.
We're finding hypertension, obesity, and certain underlying diseases like cardiovascular disease. And it is thought that there is a greater prevalence of some of those in our African American population.
But the scope of exactly how widespread the disparities are across the country remain unknown because right now only 8 states are including race when reporting coronavirus cases. Currently, Maryland is not one of those states.
Without the data, we're literally shooting in the dark.
Tuesday, Governor Larry Hogan directed the state health department to include demographic breakdowns of race in the state's coronavirus data. The move came after Delegate Mosby and more than 70 other lawmakers urged the governor to do so. But Mosby says the governor needs to go a step further and include zip codes as well.
Data will literally tell us what communities are impacted the most, what communities we need to go after, and ensuring that we have a plan that's effective and equitable as relates to engagement, testing, and treatment.
Baltimore Mayor Jack Young expressed his support to release the data during a news conference today, but he says he's been waiting on the state to give them the information.
We asked for that information, but the state has it.
And Baltimore City Council introduced legislation to direct the city's health department to include race and zip codes in their coronavirus data as well. Dr. Mani, who is a part of the state's coronavirus task force, says that information could be available as soon as Friday. Live in Baltimore, Ray Strickland, WMAR 2 News.
All right.
Senator, President Trump is aggressively advocating hydroxychloroquine, an anti-malaria drug, yet Dr. Fauci has repeatedly warned that there is no real conclusive evidence to support using the drug for coronavirus. Why do you think he is pushing that drug so hard? I mean, does he have information that we haven't been provided?
Sonny, your guess is as good as mine. I have no idea, but what I do know is this. It is a drug that has been proven to give relief from pain and almost disability to people with rheumatoid arthritis, people with lupus. And right now, I'm hearing all over the place that people are hoarding this drug in a way that those who need it to relieve their pain and extend the quality of their life may not be able to get it, all because the president keeps taking the stage. And as opposed to what Dr. Fauci and medical health professionals are telling us, pushing this drug. He's got to stop. We don't want a drug pusher for president. We want somebody who takes that stage and speaks to the crisis in a way that is about bringing relief. I mean, one of the things that I've been focused on, from my years of being Attorney General, is consumer protection. 10 million people as of last week, and just over the course of the last few weeks, lost their jobs. 10 million people. One of the things I'm focused on, and I'm proud to announce it on your show is I'm calling for a suspension of credit card interest, fees, and penalties. Because right now, there are people who are out of a job, who did not plan for this moment, and are going to be buying groceries with their credit cards. And those exorbitant fees that people are charged anyway, they should be suspended during the course of this pandemic. So I'm calling on a suspension of credit card fees and penalties and interest rate for the next 120 days, because people are not going to pay their bills on time. A lot of folks just are not. And at the end of this pandemic, it's going to be awful for them to be trying to get back on their feet, find a job, get back to that small business they were working for, and deal with these exorbitant fees. The other thing I'm calling on is to say that we should suspend negative reporting to credit scores. Because the other thing that's going to happen, again, people are not going to pay their bills on time. And then it's going to go on their credit score. It takes a lifetime for people to clean up their credit scores. And folks should be able to have as much as possible to get back on their feet after this pandemic. So that's the kind of leadership we need. Speak to the issues that are affecting people right now and try and find relief for folks based on the authority of your office. But I don't know what this guy is doing.
Senator Harris, this is Megan again. I think that's a very patriotic and noble idea, and I hope that bill gets passed, because you're right. How can we expect people to pay their bills when they're incapable of working? On a totally separate note, I want to ask you about something that's really, I think, disgusting and very hard for the American public to watch, and that is the absolute disproportionate impact that the coronavirus is having on African Americans.
Yeah.
In Louisiana, 70%, this is insane, of the deaths are African American people. We are seeing similar racial patterns in other states here in New York City. What should we do? Why do you think we are seeing this disparity? And if we don't do something about the inequality, will this country be able to recover? One of the options we thought on this show was maybe FEMA needs to start sending in extra medical care and extra medical tents into some of these cities and areas of the country that is being hit so hard.
Thanks for bringing that up, Megan. So the fact is that during a crisis, it magnifies the disparities that existed before the crisis. And in a crisis, people who are doing bad do even worse. And so on your point about racial disparities, we know that African Americans and children are 20% more likely to have asthma. The African Americans are 40% more likely to have high blood pressure. Black women are 3 times more likely than white women to have lupus, which we just discussed. Sickle cell anemia, one of the things that threatens anyone who is living with sickle cell anemia is a respiratory virus. So those who had pre-existing health conditions based on racial disparities, based on socioeconomic disparities, are doing even worse in the midst of this pandemic. And so it requires us to address it in a way that also recognizes the historical nature of it. For years, I've been working on Black maternal mortality, which before this pandemic was very real. We were talking about it. Black women are 3 to 4 times more likely to die in connection with childbirth than other women. And when we looked at the issue, it had nothing to do with that woman's education level or her socioeconomic level. It literally had to do with the fact that when a Black woman was walking into a hospital or a clinic or a doctor's office, she was not being taken seriously. So these are issues that have to be addressed. And you pointed to one solution, which is about FEMA directing resources to those communities that we know had disparities before this pandemic, and those disparities are going to be exacerbated by this pandemic.
All right, a lot of strong, opinionated words from a lot of Blacks, and that's how it is. But we had to do our part, and we in this together. And if we do our part, we can get through this. Like I said, COVID-19 is just here temporarily, and if we can fight the cause and we have the the fight to do so and do safely, we can make this. All right, just like I said, wash your hands, stay 6 feet distance, and wear your face masks at all times when you're out in the public due to your state and local government edict. I've been your host, Kendra Dick, saying so long for this edition of Viral. See you later.